Forgot to record.
Okay.
Okay.
So what we're going to try to work on today is discuss the uses and effectiveness of CBD. Oh, that's to say CBD, not CBC oils. Be familiar with the qualifying conditions for medical marijuana in Ohio and list the desired and adverse effects of medical marijuana and CBD. And one of the other things Danielle had asked about was memory, how it can help with memory, if there was any literature out there on that. So, and there actually is some out there. So we'll talk about that too. So the history of cannabis. So CBD and medical marijuana have been around for a very, very, very long time. In 2727,
Wow.
yeah, Emperor Shangmeng of China drank it in a tea to try to help with ailments. And then as time has gone on, you know, it's controversial, getting less so as we learn more about it. The AMA, you know, opposed both acts in 1942. In 1964, the chemical structure of THC was discovered, which we'll talk about the difference between THC and CBD today. In 1970, the FDA made Schedule 1, no acceptable medical use, because back in time, we used to use heroin and cocaine as treatments. I mean, those are actual medical treatments that we used, and we know now what those drugs can do for us and what they can do to you. And so they kind of lumped cannabis in with those. Also in the 70s, though, they realized, gosh, this is really helpful for the use of chemo patients with nausea and vomiting. And then in 1980s, when the AIDS epidemic came out, it was used for wasting. And what that meant was, I don't know if you ever remember seeing pictures of AIDS patients back in the 80s, but they looked very malnourished. And so it helped with that. And then in 1996, California, like they oftentimes do, are the forefront leaders, made it legal for medicinal use. And to think that that was already 25 years ago is crazy. Okay, so just a little bit more history. So hemp and CBD, hemp farming has been around for, again, centuries. And it was used for different reasons, removing bugs from ears, general pain relief, and for food. And in the 18th century, believe it or not, people could be jailed if they didn't grow it. So that's an interesting, they'd have to pay a fine. And then it was eventually banned altogether, which, you know, you've seen pictures of massive weed farms getting, you know, the Drug Administration finding massive weed farms by air. And then CBD oil was first discovered in 1940, but the cannabis extract was only sold in the UK until federally legal in the United States in 2018. And so this is just some more information. The latest update was the Food and Drug Administration approved in June 2018 the first CBD derived drug, which is called Epiolex, which contains purified CBD and it's used to treat certain childhood seizures. So, and they have found really good outcomes with that medication. So THC versus CBD. There are approximately 113 unique cannabinoids in cannabis plants, which can be classified as hemp plants or marijuana plants. CBD is one of them, and it is the second most prevalent cannabinoid found in the plant. THC is another. So the big distinction, and this is what's really important to take away from this, is that THC, not CBD, is the one that is responsible for the high, the traditional high. So when you see someone smoking a marijuana joint, or you see someone after they smoke a marijuana joint and they're kind of in a euphoric type state, it's the THC portion of that that is causing that, not the CBD. okay? So they have separate properties. So the CBD oil certified products, so those are the ones that are legal, contain less than 0.3% of THC. Okay, so that's why we're able to see these CBD oils out and for mainstream use, because they do not have that THC component in it, or very minimal, 0.3%.
I gotta download Zoom.
So THC, tetrahydrocannabinol. You know. So THC is much easier to say. So it's the primary psychoactive component. And what that does is it increases the serotonin production. It blocks the NMDA receptors, neuropathy. It stimulates the endorphin release, and it also has anti-inflammatory actions, but it is also, like I said, the part of cannabis that makes you have that high. So I don't know if you've seen signs like this where it says CBD products now sold here. So cannabidiol, CBD, it's not psychoactive like the THC. It also has anti-inflammatory, analgesic, antiemetic, so for nausea, antipsychotic, anti-ischemic, helping with those the blood flow, and the anti-epileptic, so for seizures. It has those type of effects. It does oppose some of the psychoactive properties of the THC, but there's only normally a small amount of cannabis in the actual plant. So sometimes it can be kind of hard to come by. Okay, so CBD versus full spectrum cannabis. So CBD, so basically what this means is what I can get out of the store and what I need a prescription for, okay? So CBD is easier to get, it's cheaper, it has fewer side effects, but it's also typically less effective than the full strength stuff, which you gotta jump through a lot of hoops to get. It is pricier. Sometimes there are significant side effects, but they are more effective. And that is where we get into having a medical marijuana prescription card. You have to have a licensed physician who is licensed to distribute medical marijuana cards, and not every physician has that licensure to be able to do that.
Can I ask a question?
Sure.
I've done a little bit of research on this, and I thought that you could get CBD full spectrum. You could walk into a CBD place and get what they say, oh, it's better to get the full
You
spectrum.
probably can. It's going to be all those other things, though. It's going to be more expensive. It's going to be cost. Well, it's going to be more expensive to have the full.
Yeah, but
typically you've got to have a prescription card in order to be able to get. So kind of in the way the medical marijuana prescriptions are written is a little strange. I wasn't aware of how this was done until we're lucky enough to have a prescribing physician who has the medical marijuana prescribing ability, Dr. Christian Jacobus. And what they kind of do is just write for a broad spectrum prescription. You take it into the dispensary and you get to choose what you want. So you get to choose whether you chew gummies, or whether you have oils, or whether you have sublinguals that you dissolve under your mouth. You get to choose what you want. You can walk into a dispensary, but you can't get everything that a medical marijuana prescription card can give you. Does that make sense?
well, I'm not even talking about a dispensary. I'm talking about a place in Warmina I walked into where they sell CBD.
Yeah.
And
And they said they have full spectrum.
yeah, they encourage you to buy the full spectrum. And of course, I looked at it when they said that, and it was more
Yeah.
expensive. But it was something I could buy, it's in there.
Yeah.
Right?
That could be, yep, that could CBD. So medical marijuana, so for those prescription cards, for you to actually be able to get from the dispensary, quality products that you know has had some look through. These are all of the approved diagnoses as of right now. They're seemingly adding more all the time. But these are the ones that if you talk to a physician who's got a medical marijuana prescribing card that can give you, these are what you can get a prescription for medical marijuana for, okay? These are what some of the things look like, so forms of how it comes, how it's available. So there is a vaping pen that you can get it in. There's oral solution, gummies, chocolate, sublingual, creams, patches. It comes in all sorts of forms to be able to get it. And like I said, it's up to you how you would choose to take that. Now, I have a sister-in-law who's got progressive lateral sclerosis, kind of the sister to ALS. She prefers the oils and the gummies. She finds it very effective in helping with her symptom management. She's got terrible muscle spasms. So it really helps with her muscle spasms.
When you say oil, do you mean like drops?
Yeah.
that you take?
Yeah, well, you can put them on your skin, or there are drops, the sublingual drops you can put in your mouth. But there's also like oil, like a cream oil that you can rub on the
That you
area.
rub onto your-
Yep.
So if you got a chronic pain, and if your doctor has to be okay to prescribe that medicine, then you can, like, if you got the oil, you can just rub it in and that would take care of the pain.
Well, hopefully, not necessarily. So if we don't get anything else out of this information too, is I strongly encourage you to talk to your physician before you would try anything like this. Some physicians are really on board with,
And
You know,
some aren't.
and some are not.
Mine said, I know nothing about it.
Right. And so, you've done research yourself though. You're working on that. You're trying to educate yourself and get the information. So I wouldn't do anything prior to talking with your physician, and making sure that, you are letting them know why you're wanting to do or seek this treatment, and get their thoughts. But as always, you are the patient, you have rights. But I always say, talk to your physician, talk to your physician, talk to your physician.
Do they ever refer you to another doctor if they don't do anything themselves?
We do have doctors that refer over to us. So our doctor is also in palliative care medicine. And so when we get a referral over for our doc to prescribe a medical marijuana card, he does a complete thorough assessment on the patient to see, if he feels like it would be beneficial to the patient, and if they qualify, and then we'll send off the prescription for them to get their medical marijuana card, because you get a card. So for instance, like my sister-in-law, there's no way she could get to the dispensary to go get that. So my brother has a card to say, I can go pick this up for her. Yeah.
But not every pharmacist sells that.
No. He goes to an actual dispensary up in
Okay.
Toledo that is licensed to dispense these products from a prescription card.
Well, what about that one in Bowling Green on the north end of town that you could buy medical?
They're out there. They're all out there. They're all out there. But you really just have to do your research and make sure that you feel comfortable with that the product that you're getting is a good product.
But you don't that the person out on North Main can sell whatever?
That I can't speak to. I can't speak to that.
You have to have the prescription. when
You don't
want
have to
it.
have a prescription for
Not for
CBD.
Oh.
No, not for CBD. No,
But you have to be careful what you get.
Exactly.
where you get it.
you really have to research.
Right.
You really, really have to research the product. Yep. There's also a vape marijuana. It kind of vapes up into the room.
Wow.
With these, they've shown, at this point, they show no increased cancer or COPD risk. It seems to be protective, and it further minimizes risk. So cannabis effectiveness. So, we're talking about this. Is it effective? So there is conclusive or substantial evidence that cannabis or cannabinoids are effective for the treatment of chronic pain in adults, antiemetics in treatment of chemotherapy-induced nausea and vomiting, for improving patient-reported multiple sclerosis spasticity symptoms. So remember I was talking about my sister-in-law's muscle spasms? That's why she takes it, because it does help with that spasticity. There's moderate evidence that cannabis or cannabinoids are effective for improving short-term sleep outcomes in individuals with sleep disturbances associated with obstructive sleep apnea, fibromyalgia, chronic pain, and MS. There is limited evidence that cannabis or cannabinoids are effective for increasing appetite, right? You hear that a lot. I went and smoked a marijuana joint because I wanted to eat, or I wanted a brownie, to get the munchies. But again, it's not the CBD part that's, so they're saying that cannabis has limited evidence of helping with this. Tourette's, anxiety, and PTSD. It is ineffective for, so there's limited evidence that cannabis or cannabinoids are ineffective for improving symptoms associated with dementia, improving intraocular pressure associated with glaucoma, and reducing depressive symptoms. So we're gonna circle back around to the ones associated with dementia down here in a few slides. So the review on a study of marijuana for Alzheimer's disease, because again, all of this is sort of newer evidence coming out. And these results implied that CBD components of cannabis might be useful and prevent AD because CBD components could suppress the main causal factors of Alzheimer's dementia. Moreover, it was suggested that using CBD and THC together could be more useful than using CBD or THC alone. So them combined together might be more helpful than, but again, none of this is FDA approved for that reason. Okay, it's really important to know. So this is some of the things that they're looking at. It potentially can reduce inflammation, reduce oxygen buildup. It can be a brain stimulant, improve movement, reduce stress and anxiety, and reduce decline in memory and other brain functions. So that's what they're kind of looking into is, are there benefits with somebody with dementia getting some CBD or THC use? So some adverse effects. 30 to 60%, dizziness and lightheadedness. I mean, that's a pretty significant number. Dry mouth, fatigue, muscle weakness, myalgia, and palpitations. So those are some of the things that we can see when we're using these products. And of course, not everyone is going to have those issues. Marijuana toxicity, there are no documented fatalities. The greatest risk is for children with edibles. You've probably seen that in the news some. Those look like regular candy to kids. They're not really marketed any different. They look like a little bear. I mean, it seems. So that can cause respiratory depression in a child who might get a hold of those things. 9% of users will develop an addiction syndrome. Withdrawals can contain irritability, insomnia, nausea, anxiety. And we put up to compare. So tobacco, 32%, heroin, 23%, cocaine, 17%, and alcohol, 15%. So just in a comparison. Oh gosh, that was it. Shoot, I kind of went through that kind of fast. But these are all where we got all of our information. So our Dr. Christian Jacobus put together a really nice presentation for clinical staff. And this dementiacarecentral.com is where I got that last slide on the memory use and where that's coming into play. Do you guys have any questions at all?
Yeah.
Go ahead.
So where does one go if one PCP knows nothing about this?
So what I would say is ask him where he can guide you. Say, I know that you don't know anything about this, but is there somewhere that you can go, that I can go, that can guide me on perhaps, what to do? The internet is also a great research engine to figure out products, what's safe, what's not, doing all of your research, but I would definitely go through your physician. And it sounds like you have,
I tried.
and you talked to him, and he said, not really sure. Do you have anybody that you know that's using cannabis or CBD oils or anything like that for?
I heard
Treatment of
I
chronic
heard
issues.
about a cousin recently who was taking the capsule, or not capsule, tablets, I guess.
Mhm.
Are they as good as, you know?
I can't answer to that. I can't answer to
They're
that.
all different. I mean, you have to see how, like the percentage
Yep.
of CBD that's in them, and
Yep.
all that kind of stuff.
We
We have a
haven't
friend
given that information.
on the bottle or box or whatever, you just have to figure out, you have to do research if your doctor's not gonna help you, to find out how much CBD you need to make it effective
Right.
for what you need.
And really important to note, remember, it's the THC that has the psychoactive part, not the CBD, okay? It's the THC part that's got those ones that kind of, can make you feel that euphoric feeling.
We have a friend that takes those CBD gummies all the time, and she's terrified by it.
Yeah.
But she's done all the research and figured out, which ones work for her.
Yeah.
And the-
And people that use them do swear by them.
I'm on medication for OCD. I thought about trying it, to see if there's anything that works.
Mhm.
I don't know, look into it. But, I'm a little apprehensive about going to a smoke shop and buying it.
Yeah,
But I don't know if they have good stuff or if it's, I don't know.
yeah,
Well, I've never been to one of those places anyway.
yeah.
I don't know. Yeah, I'm sure there's a lot of junk out there.
Mhm.
I'm pretty sure if you're at like Circle K, you're not gonna get really good.
Yeah.
Right. Like I said, I
Yeah.
would strongly encourage you to talk to your physician
Yeah.
about it and see what they have to say. But it is right now because it's not, it's not widely talked about at this point. People that are using, but it's something that if you feel strongly about it and you're inquiring about it and you're inquisitive about it, I certainly encourage you and would continue to encourage you to research. And again, talk to your physician to feel like it's the right decision for you to try.
Well, in some ways, it's not really any different than buying supplements, like vitamins
Right.
and that sort of thing. I mean, you say, okay, I should take vitamin C every day. So then you have to look at which of the products have what amount of
Right.
vitamin C, and do they have a bunch of other crap in there too, or,
It's overwhelming.
yeah,
Mhm.
it does.
And you also want to make sure that whatever you would try or take would not interfere with any other
I
medication.
was just gonna ask
That you
that,
were
I know that's a medical question,
Yeah.
but in a general sense, are they finding that they can do the CBD in addition to other medications that they're taking, or
Well,
you have to watch that, or what?
Well, I would certainly watch it, absolutely. But I mean, like I said, we are able to get cards out there for people that have, so they're, it is able to be used with other medications that you're already taking. However, you would need to make sure that whatever medications you're taking wouldn't have any interaction with that we know of.
Well, only the pharmacy can tell you that.
Yeah.
right?
Correct.
Now, the pharmacy I go to does sell the product, and I'm doing it too.
Have you talked to the pharmacist about it?
No, not yet.
Yeah, maybe that's a good avenue.
Yeah, they're terrific.
Yeah.
But, which pharmacy? Pardon me? Which pharmacy is good at Churchill's in Perrysburg? So, but the assumption is that because it's a pharmacy, and I have so much faith in the pharmacist there, that the products are gonna be good quality.
Yeah.
You know, that's another issue.
Well, that's kind of with anything in the medical field, right? We trust our physicians to do right by us. We're trusting our pharmacists to do right by us. So, you know, we trust nurses to do right by us. That's something that we have to trust, that they, know what they're talking about, and know what they're doing. So it's definitely a good avenue to go down and talk to the pharmacist.
Good idea.
Yeah.
The dispensaries, I always like to go in to the door unless you have.
I think if it's an actual dispensary, that is correct.
Okay.
Because I would say that they have CBD products.
But I'm not, don't hold me to that, but I'm pretty sure if
So, I have a question. So you have a medical marijuana card. The products that you can only purchase with a medical marijuana card, do they all necessarily contain THC or do some of them not contain
No, I don't
THC?
think they necessarily have to contain THC.
So there are some products without THC that you still need a medical marijuana card for.
That I can't answer.
Okay, not sure about
Yeah,
that.
I can't answer.
Okay, that's where I think the line is blurred for me and I don't quite understand.
Yeah. But I
Are,
can find that answer out for you.
okay, are there some CBD oils that are strong enough that you have to have a medical marijuana card for them?
Again, I'm
Not sure.
not
Okay,
sure about that.
Okay.
But those are all questions that I could ask my doctor and find
Right.
out for you.
okay.
If they don't have THC in it.
You shouldn't need the medical marijuana card.
Right.
Okay,
There's no THC.
that's the,
Correct.
This thing that's considered.
right.
Go ahead, yeah.
I heard that it was helpful in problems, people who have problems sleeping.
It can be. It
And
can be.
I don't like to take liquid pills, which I know are addictive, but tell me this can be addictive too.
No, so I think back on the slide, it said, I think there's a 9% addiction rate.
Yes,
So it's a very low addiction rate.
less addictive than alcohol.
Right.
Yeah.
Correct. So, like I said, it's really all about the research and
There's the
really
addiction.
trying to figure out, if it's right for you. By talking to your physician, talking to your pharmacist, talking to, people who are well versed in this area. So, because it's scary, because people think, everything is all lumped into one and it's not. Putting some CBD oil on is not gonna be like smoking a marijuana, joint. It's not gonna be the same thing. Yeah. But we've kind of made it a taboo subject, right? And we've kind of lumped it all together. So the goal of today was to try to show you that there is a difference. And we have to just look and see and talk with our doctors and see if it's, something that could potentially be helpful for you.
Bob?
Methods by which you can take, like, sleeping pills, sleep.
Well, remember I showed you that slide that shows all kinds of different ways that, right here, that you can get administered. So, like I said, you can do oral, you can do a gummy, you can do chocolate, you can do a cream. There's all kinds of ways. That you can.
That would do all the same thing?
Well, yeah, except the cream, obviously, wherever you're putting the cream, it's going to be kind of localized to that area, initially, anyway. But yeah, any way you ingest it, the patch, sublingual, chocolate, gummy, oral, it's all gonna have the same effect. It's just how you prefer to take it.
So Larry, Barb, or Julie, did any of you have any questions?
We're good, thank you.
Okay, Julie, how about you? I've not had any questions, so. Okay.
Hi, Julie. I recognize Julie from bingo online.
Yep.
Did you talk about expense before I did? Yeah.
So CBD is pretty cheap. The full spectrum is more expensive. And you know, with the medical marijuana card, that stuff is more expensive. But CBD, again, it's a range of products. It's a price range of, but it's typically not as expensive.
And I just thought of something too. I said before that the CBD place I walked into had the full spectrum that I could buy without a medical marijuana card. That's the broad spectrum.
Oh, okay, not full spectrum. Okay. Okay, very good.
Did you bring any paper copies of the?
I did not.
I
did
can,
not.
I can print some.
Okay.
Yeah, I can print some for you.
Oh, good. Yeah.
Not right this second, but when I get hooked up, I'll print a couple copies. Yeah.
Because something like this would be nice to have it on paper that you could look. Remember all. Yeah. that you could look back on. And, you know.
Yeah.
Can you tell us where to go in this general area? Can we go into a dispensary to get information?
Oh, I don't know. I can't answer that. I would say your best bet is to look online and see, general information about the dispensary. And see kind of where you get from there. But my understanding of a dispensary is that you have to have the medical marijuana card in order to be able to.
I'm looking at a place right now.
I
just to
can't see if you just walk in to that place off the street, that they're gonna give you any information.
I'm not.
If you don't have a card.
Yeah, and I'm not, there's so many avenues that you can go down with this topic. And like I said, I wanted to focus kind of on, the differences between CBD and THC, for you, but it's just endless. I mean, there's just so many, like you said, so many questions, on, you know, can I get into a dispensary? Can I purchase from a dispensary? Am I just going to a regular shop, like a smoke shop, and getting, these products?
So I'm looking at, there's a place in Maumee called
Yeah.
Bloom Medicinals.
What
Um,
street is it on?
It is on Conant
Yeah,
Street.
that's where I was.
Okay. So you were inside that store. So they let you in without a medical marijuana card. This says it is a dispensary.
Yeah.
I think that was strictly over the counter stuff.
Okay, so this does say that our Maumee dispensary is located just off Conant Street, handicap accessible. We will have medical marijuana flower, tinctures, oils, transdermal patches available for qualifying patients to purchase.
Right.
Okay.
Patients,
so
patients will also be able to attend our educational cannabis events to learn more about the different forms, benefits, and uses of products allowed by the state of Ohio. For patients who are looking for a more private setting to discuss our products, we offer private in-store consultations by appointment. So if you were interested, I'm sure you could probably call this place, ask them if they would, you know, take you for an appointment to explain more without a medical marijuana card and see what they have to say. This, to me, looking at it, looks like a very reputable place.
I'm pretty sure
I'm not an expert,
I
but
think that's where my brother goes.
okay, yeah. This
I
is,
think that's where my brother goes to get my sister-in-law's, items, but again, it's a dispensary, and he has the card to be able to get the stuff that's not available to his sister also.
yeah,
Well, it would just seem that a dispensary would be more reputable
Yeah,
and accurate than a retail store,
yeah.
which is what that is.
okay. I just found another page on here. It says first visit, what to expect. As a first-time patient at our Ohio dispensary, you will need the following documents: a patient ID card, government-issued ID that was used during registration at your recommending physician's office. And then if you're a caregiver, like your brother, they need a caregiver ID card, patient ID card.
Yeah.
So it sounds like, I mean, you could always try to call and see if they talk to you without having a card, but this kind of sounds like they want you to have a card from your physician before they talk to you.
And you have to have one of those conditions in order to qualify.
So in the state of Ohio, there are only limited disease processes for which you qualify for a medical card. That is correct. There are, and it's growing all the time. Because they're finding out more and more the benefits of it. Exactly. Sure.
My daughter just told me the other day, she was in Cleveland, and she told me the friends that she has, that have medical marijuana cards are going to Michigan.
Yeah.
To get them to it. And why is that?
Yeah.
You know,
It's legal in Michigan. You can get just marijuana.
Yeah. The rules in Michigan are quite different than the rules in Ohio. Yeah, and it is by state. Rules differ.
they're more liberal in Michigan.
They're, with this particular topic at this point, yes.
Would it be cheaper there in Michigan also?
I can't answer that.
You
I
don't
don't
know.
know. I don't know.
I know a lot of people go to Canada, used to go to Canada to get their medication. They said it was cheaper in Canada than it is here, so.
How about Canada? Did you get it in Canada?
I'm not sure.
And you probably shouldn't get in.
You have to get it in Canada anymore.
Yeah,
I
you,
thought they blocked that again.
no, if you're vaccinated, you can, I don't think if you're not vaccinated, you can't get
It's,
over.
okay, so they're gonna.
But if you're vaccinated, if you can prove vaccination, you can get over.
Yeah,
Yeah.
well, they complain about wearing a mask, I'm sure they're not gonna show you your card. That's their private, you know.
Well, that's a whole different rabbit hole.
Anyway, you know,
Well, apparently the place in Bowling Green on North Main, you can't get in without a card.
without a card.
Okay.
Yeah, I thought it was probably that way.
That's what I kind of figured, because,
that?
well, North, used to be the bank, Glass City Credit Union, and North
Right by the
Main.
Eagles.
Yeah,
Somebody
it's down from Kroger's, not very far.
No, they're actually,
Yeah.
and it's a dispensary?
Yeah,
Really?
yeah,
It's where the old, the old,
Well, you
right
can
by the
go-
Eagles.
yeah, it used to be a bank,
It's shaped kind of like this. so,
yeah.
Yeah.
I don't know what to do right here. I don't know why. I'm not even really interested in a medical marijuana card. I'm interested in CBD.
Right, yeah.
And I want reliable information about it.
Yeah, so it's just super important to be able to do your research, figure out again, with hopefully your physician's help, if it's the right move for you.
I'm here, from the little bit I looked online, I guess there's a list of doctors, you can look up a site where there are doctors listed that will help you with this topic,
Yeah.
if your doctor won't.
Yes,
I don't know, we'll have to talk to our doctors with osteopaths. And so
okay,
I think they tend to be a little more open to
Yeah.
some alternative kind of stuff. So we've never talked to her about it, but I would guess she is probably, would probably help us if we wanted to find out about it.
And what did you say?
She's an osteopath, she's an EO.
Instead of an MD.
Oh, she's an MD, she's an EO. Which is, I mean, she's a medical doctor too, if I've never heard of that.
I don't know.
Oh,
if it's
yeah.
doctor or what, lower back pain and.
She's an osteopath, there's a bunch of them around. They also know that alternative medicine, so it's not just,
My leg so
you know,
much.
medical.
Yeah.
It's just,
yeah.
Yeah, right.
And Jackie was down to death.
She was right up here at her desk, so it was perfect. I didn't have to go far.
Always.
All right, well, thank you all for coming out today. I hope you learned a little bit of the difference between the two products. The question